welcome to Concussion Talk Podcast. My name is Nick Mercer. I write Concussion Talk, www.concussiontalk.com. This is episode 15 of Concussion Talk Podcast. I'll be talking to Kristine Miller. Kristine is a PhD, a physical therapist, and researcher looking at how yoga improves physical functioning in people with traumatic brain injuries. Hi, I'm on the phone with Kristine Miller, and I will ask her to introduce herself and talk about where she works and what she does.
All right.
Please, Kristine.
Sure. Good morning, Nick. Thanks for talking with me a little bit this morning. My name is Kristine Miller. I'm a physical therapist. I work for Indiana University in Indianapolis, Indiana. I'm faculty in the academic physical therapy department there. So I teach in the neuro rehab content for physical therapy students. I also do a lot of research with folks who've had stroke and brain injury. I have about 27 years of clinical experience treating folks with stroke and brain injury. So that's sort of my history.
Well, okay, I'll ask about your inpatient experience a bit later on. But
Okay.
You wrote a study that I tweeted out a while ago. And I found it very interesting because I just recently started yoga. So, and I've been applying for a while, for 4 years now. But I just recently started yoga. And but I saw the study, and I'd like to, the study is titled Feasibility and Results of a Case Study of Yoga to Improve Physical Functioning in People with Chronic Traumatic Brain Injury. And it was in the Journal of Disability and Rehabilitation.
Mm-hmm.
So, what is a chronic traumatic brain injury? I've heard the term acute brain injury, traumatic brain injury a lot. And is there a difference? Is it just the length of symptoms, or are you talking about symptoms, or are you talking about the actual injury itself?
So it's really the length of time since the injury. So an acute injury is immediately after the injury. Then we kind of go through a subacute phase, which is usually around 3 to 6 months, somewhere in there. And then when folks get beyond 6 months after the injury, they're usually considered chronic. And that's just sort of medical terminology to distinguish between a new injury versus an old injury.
Right. Okay. So great. So I have a chronic traumatic brain injury now. And,
yeah.
Okay. So acute is just I thought it was just time different. So all these patients in your study are all chronic. Obviously?
Yes. Yeah. So they were all finished with their rehab right after the brain injury, so they were considered chronic. Yes.
And about how long would you say they were away since their brain injury? You said 3 months is acute, subacute, right?
So it was variable. So we had one person who was close to 20 years since the brain injury, and another person who was within just a year since the brain injury. So the chronic can be once you kind of get past that 6 months on.
Yeah. I'm now almost 13 years since my brain injury.
Okay.
So could you actually just describe the study, what you did, and some of the important results?
Sure. So this was sort of the third in a series of studies that I did with a coworker of mine. Her name Arlene Schmid. She's an occupational therapist. She was working at the Rehabilitation VA Medical Center at the time, which is also where I was working at the time. And Arlene is who really started all the yoga studies. We started testing therapeutic yoga for veterans who started with veterans who'd had a stroke. And so we started there, and then we added people that who were not veterans, so non-veterans who had had a stroke, and we had really good results with those two studies. So then the third study we did was the case series study that you referenced with folks who had a brain injury. And so in the brain injury study, we enrolled folks who'd had a brain injury. They were chronic, so they had finished all their rehab. They were past sort of the acute phase of recovery after brain injury, and we enrolled them in a one-on-one adapted yoga program. They met with a yoga therapist twice a week for 8 weeks, so it was 16 visits, and did an adapted yoga protocol. The yoga protocol was developed really specifically to work on balance. That was sort of the big physical functioning area that we were most interested in, and so all the postures that we had the patients do in the yoga protocol were designed to help work on balance recovery. So participants did the yoga for 16 visits twice a week for 8 weeks. Prior to starting the yoga therapy, we did a series of assessments, basically standardized physical rehab assessments. We did that both before and after the yoga to try and measure if there was improvement or changes in those physical performance measures. Physical performance measures we use a lot of balance measures that are standardized, to measure balance in folks with brain injury. We also use walking measures, walking distance, walking speed measures. We also looked at things like activity and participation, so kind of more global measures overall of how people's activity level is and how people's life participation is going. So we looked at those types of measures. We also screened for things like changes in anxiety and depression, some of those emotionally based issues that folks struggle with after brain injury. So it was a pretty comprehensive assessment package. So we did the assessment package both before and after the yoga. What we found was some really nice changes in the balance measures. So we saw balance improve. We saw balance confidence improve. We also saw improvement in walking distance, so then how far someone could walk in a 6-minute time period. Saw some improvements in walking speed, so just how fast the patients were able to walk. Saw some improvements in flexibility. We did some range of motion measurements both before and after. We looked at sort of functional strength using a set to stand test, and saw improvements in those physical performance measures, which is what we were primarily interested in looking at.
That sounds very interesting. I wanted a question. Balance confidence, is that just from interviewing them after, or is that from a physical test?
So balance confidence is a patient-reported test. We use a standardized measure where we ask patients, how confident are you? You could do a certain activity, and there's a list of 16 activities, and we ask them how confident they are. They can do each activity without losing balance or becoming unsteady, and the patients give us their own confidence rating from 0% confident to 100% confident. And it's a standardized measure of balance confidence that we use in the clinic as well, because there's some correlation between balance confidence and fall risk. So from a big picture perspective, if we're improving balance and balance confidence, we want to be improving it enough so that we're actually minimizing fall risk for the participants, so they're less risk for falling once they finish the program. So that's why we use the balance confidence measure.
Right. No, that I know that's a very important part. I know, like, from just feeling steady and feeling able to do. I know when I'm doing yoga now, I usually do it next to a wall. I'm doing like tree pose and those poses. I can obviously walk and all that stuff now, but I just want to be able to put my hand on the wall, have it there, because my stability and my ability to catch myself, not necessarily fall, but to catch myself on my other leg. My left leg is not quick to catch myself when I fall, so that's why that's a very important measure, I think.
Yeah, well, and we do, so for the adapted yoga protocol, so the program builds very slowly. So as patients start, they do everything just in sitting, and then after a couple weeks we'll add some standing poses, and then after a couple of more weeks then we'll add some supine poses. We do ask the patients to go to the floor if they feel like they can, because we'll help them get up and down from the floor. That's a good maneuver to practice if patients are willing to practice with us when we have the help there. Sometimes patients just do not want to get down on the floor, so we do have some portable massage tables we can set up that folks can lie supine on those to do the supine poses. But we also have volunteers available. So in the brain injury study, that was one-on-one, so it was the yoga therapist with the patient, so there was always someone available to help the patient. In the case series study, and some of the other studies were their group interventions, and so it's a yoga therapist that's leading a group of participants at the same time. And in those studies, we have class volunteers available to go around and help the participants if they need help getting into a pose, if they need help moving an arm or moving a leg, or if they need someone to spot them while they're doing the standing poses. We also allow them to hold on to the back of a chair or to a countertop or a rail on the wall, sort of whatever's available in the space that we're using for safety, just like you're doing with the wall, because we want the participants to experience the poses and participate, but we also want them to be safe.
Yeah.
We kind of have a rule in my current project, which is a group project for people with stroke and brain injury, that when we're doing some of the standing poses and we're doing, trying to do forward-facing hero and some of those types of things, that our class rule is we ask the participants not to let go of whatever they're holding on to until someone's standing there to spot them, so that they can still do the experience of the posture, but we can make sure they're safe doing it.
Okay, so why did you pick yoga as the case study exercise? Was that because there's research, or?
Sorry, that's my other phone.
No worries.
Sorry about that.
No worries.
So we specifically were looking at yoga, and so again, wanted a modality that would be typical, sort of in the community type of modality, because we were working with patients who were done with rehab and were kind of trying to engage in meaningful exercise after they'd finished structured rehab. So we wanted a modality that would be a typical community-based modality, and yoga is available certainly in the community.
Yeah.
Also, we're interested in something that would specifically work on balance, because balance was the big marker that we were concerned about, looking at balance and fall risk and that sort of thing. And the postures, are many postures in yoga that work on balance components. And so it was a nice fit that way. The other thing that's nice about yoga, because yoga is more of a whole body practice. And so specifically we use kind of a hatha yoga program, which looks at breath or breathing as part of the process, and then the postures, and then finishes up with some sort of meditation. We really kind of like that for folks who are recovering after some sort of major injury, neurological pathology, that sort of thing. Because with breathing, we can control we can learn to control the set of the nervous system through our breath a little bit. The nervous system, we have kind of a revved up version of the nervous system and then kind of a powered down version of the nervous system. And breath is one way we can sort of control where we are on that continuum. So, and certainly folks who've had a brain injury oftentimes struggle to find a happy place on that continuum in regards to whether the nervous system is really revved up or a little more powered down. And so breath is a way that folks can learn to control that themselves. And we get a lot of anecdotal reports from the participants about how much they use the breathing exercises, just various times in their day-to-day functioning. I went to the dentist and I used the breathing to sort of calm myself down before the procedure. Or I was getting ready to do a transfer and my spasticity or muscle tone was just sort of out of control. So I stopped for a minute and used the breathing to try and help everything calm down. So we picked it for that purpose, and we get a lot of anecdotal reports that, patients really appreciate that part of it. Also, breath allows folks to kind of focus and be mindful, kind of be present in the moment and appreciate their body and their current situation. And we wanted to help patients work through that a little bit, because I think that helps a little bit with healing. And then the meditation at the end. So for our meditation, for all of our classes, we've used a guided relaxation instead of a meditation process. We did that because early on, all of our studies were with veterans, and many of the veterans have PTSD or post-traumatic stress disorder. And sometimes a meditation process with someone who has PTSD, that kind of takes them through some of those realities that they struggle with. And we weren't really staffed with psychologists and that sort of thing to manage that kind of reaction to a meditation process. And so we use the guided relaxation instead, again, to help people kind of focus on their body and be mindful and improve body awareness and kind of relax one body component at a time. And so we just felt all of those things could be very beneficial for folks who'd had a stroke or a brain injury. And so that's how we came to choose yoga as a modality.
Wow, that's me answered a lot of my questions. I was going to ask you especially about focus. I know, and not so much now, but I know focus was a major issue for me and for many, both brain injury. It's definitely focus, but like you're saying, the breathing really helps you center and stay in the moment, and allows you to just really think about the now, which is good for, I assume that's what's really good for the focus, just breathing and being better, for lack of a better word, calm. And so you answered my question about why is it so good for people with brain injury, why yoga is so good. And so my next question actually is, you mentioned where you worked 27 years as a clinician.
Yeah.
So during your time in those 27 years, or in your time in university, was there any mention of yoga or any mind-body exercise practice mentioned as a thought of as a way to help people with brain injury, or is this a newer type of
Yes. So
interest?
my perception is that it's relatively newer thought process. Certainly, when I went through my initial training, we talked a little bit, because this was a long time ago. Talked a little bit about mind body, but it was just sort of more an introduction. There are things out there, and then here's what PTs do. So it was sort of handled in that way. That was a long time ago. In terms of within the rehab process, I would say it's been within the last, so I've been doing yoga studies for about 6 years, and probably even a few years before that, when we started to hear rumblings, right, that we need to think about this kind of the more holistic approach and mind-body connection, and there's starting to be conversations. I think the struggle in rehab is figuring out how to work that in with the already very full rehab schedule that exists for patients, because they get a lot of, very traditional OT, PT, speech, psychology, service, therapeutic recreation, depending on sort of what setting they're in. And so it's kind of trying to figure out, so how do we then add something else to that full menu? We did, Arlene and I, when we were at the VA, we did one study with acute inpatient rehab. We did 2 sites, one with the acute inpatient rehab unit at the VA hospital and one at a local freestanding rehab hospital, where we tried to implement some adapted yoga during the inpatient stay of rehab. What we found when we did that and the piece that the patients really liked the most, and we found ourselves doing the most, was the breathing. So many of the patients, once they finished their regular therapies, they were pretty physically tired, and so the physical aspects, the postures, were sometimes it was too much to ask them to do that. But the breathing and the relaxation, the patients were very interested in participating in, and wanted to do that part of the yoga. And so that's been a few years ago that we did that study, actually within the inpatient rehab setting.
Well, actually, just going back to stay for one final question about your study is that it's 1-to-1, right? So, did your patients make any note of the importance of 1-to-1 for private sessions, or did you discern any importance of that 1-to-1 ratio, or is that just happenstance?
So I definitely think the rapport with the yoga therapist was a piece of the value to the patients, because we didn't do focus groups. We did semi-structured interviews with patients after they finished the program, asking them what was good, what was bad, what would you change, what would you keep, because it was part of a research protocol. And we got to what we called it the Nancy factor in our studies, because our yoga therapist who helped design the protocol and ran all of our early studies, her name was Nancy Shaw. She's an amazing yoga therapist. And so when the patients would talk about her, right, about how fabulous she was and how encouraging and calming and soothing just her process of teaching them and talking them through the poses. And so there was definitely, again, we called it the Nancy factor because she was our yoga therapist, but there was definitely an element of that the patients felt comfortable, felt secure with her, were comfortable, because sometimes when you do, especially like a guided relaxation, and folks are really kind of focused and mindful and kind of scanning their body to figure out where are the tight spots, where are the comfortable spots. For some folks, that feels a little vulnerable to them. So people have to be willing to be a little bit vulnerable with the person who's leading them. And so, Nancy she was fabulous at creating that kind of comfortable environment. So I definitely think rapport with the practitioner is a significant factor. I mean, that's one of those intangible things that's hard to specifically measure, but it seems pretty clear that it's a factor.
Yeah, well, I know, like, my rapport with my Pilates instructors and yoga instructors, it's just been essential, and PTs. It's been very important to essential to my improvement and stuff. So I think 1-to-1 rapport, or just not even 1-to-1, but just rapport, even if it's with the group, is very important.
It is. It is it's rapport with the instructor, and in our groups, it's rapport with the other volunteers that are helping. They have to be able to trust that person, and it's not only from the participant. In many of our participants, they don't drive themselves, so someone brings them. And so in the groups, we tell them that, their transporter or caregiver is welcome to come into class and participate with them or watch or do whatever they want to do. And it's interesting to watch when we start. Oftentimes the caregivers are very, they help the person that they've brought. And then after a few weeks in, they start to trust us. And so they do yoga and let us help, their spouse or sister, whoever it is they're bringing in to do the yoga. But it takes a while to build that rapport as well.
Of course, yes, of course, yeah. So how long, this is just like away from the study and towards you now, how long have you been doing yoga yourself, or have you been doing it?
So I do practice yoga. I'm not a yoga instructor, but I do practice yoga. So I've been doing that for about probably 6 or 7 years, about the time I started working on the studies with Arlene.
And you do the one hatha yoga, the breathing, is that what
I do something very similar, yep.
Okay, so you had something. Did you participate at all? Did you participate with the other participants in the study when you were there, or did you just observe the class?
So I was usually working when I was there with the patients. I was usually one of the helpers, either helping them move in and out of postures, because we have found that particularly with folks who have some sort of physical disability after brain injury or stroke, that like when they get ready to transition to the floor, that's really when you having a therapist in the room is very helpful to kind of go person to person and help figure out how's the safest way to do this for each person. And sometimes even figuring out how to adapt a posture for a patient who they have a particular challenge or difficulty that doesn't allow them to do the posture how we would normally do it. And we have to figure out an adapted version or a way to work on the same muscle group but in a different way. And so the therapist still play a little bit of a role in helping figure those things out, and helping the yoga therapist figure out how to make those kind of adaptations. Right.
Okay. Well, again, this is actually my final question. Is that you mentioned before they were doing a study at the YMCA of stroke and brain injury patients.
Mm-hmm.
And so could you tell us what that study is about, your current study?
That's the current study.
Yeah.
So we're kind of in phase 2 of a pilot study there. And so we really took the yoga protocol that we developed for the studies that we did in the research laboratory, and we tried to implement that in a more real-world setting, or actually in the community at the YMCA. And so we transitioned the leadership to the YMCA yoga instructor. So we used Nancy, our research yoga therapist, and she helped sort of train the YMCA yoga instructor. And then we recruited from the rehab clinics in the community. So when folks are done with rehab and you're looking for a good exercise outlet for them, consider referring them to our adapted yoga protocol at the Y, and we've gotten really good response from the clinicians. And so when patients finish their rehab, they're making referrals, and the patients come in a similar setup. We do an assessment, they do the yoga, and then we do an assessment afterwards. We have tweaked the protocol a little bit between phase 1 and phase 2. The protocol is now once a week for 12 weeks. We made that adaptation because what we heard from the kind of the fitness center instructors and the Y yoga instructors is that the more typical pattern in that setting is a once a week class versus a twice a week class. So we made that adaptation for phase 2, and we've got our first set of data in, looking if we still have efficacy with 12 visits once a week for 12 weeks, and it looks pretty good. We're still seeing some nice improvements in balance and the walking measures. So with the other piece of this study is then trying to help patients connect for ongoing activity at the Y or some sort of fitness center, so that we can engage them more long-term and meaningful physical activity. And so we're trying to, so with phase 2, they do the initial rehab class, and then they continue in a maintenance class. And through that maintenance class, we're trying to help understand how patients can transition either into a different class at the Y to continue long-term, or if there are other classes we need to develop that are adapted so folks have an outlet for safe and effective exercise.
That's great. Actually, it's very. Have you heard of loveyourbrain.com?
Love Your Brain? No.
It's Kevin Pierce. He's a snowboard was a snowboarder in the U.S. and
Huh?
he was training for the 2010 Winter Olympics, and he was severely brain injured, just not even 2 months before it happened. So he was in a coma for a while, and he actually had a very similar story to mine. They type in time in a coma, and his issues with balance, and Lovely Brain has promoted yoga practices for mindfulness and for balance, and especially during March Brain Injury Month in the U.S. And actually, Brain Injury Month in Canada is now in June.
Huh?
And my provincial association, we're encouraging people to go to a local yoga studio and get them to sign up, or Pilates studio, some mind body exercise studio, to go there and to hopefully get them to sign up, to get the yoga studios and Pilates studios to sign up for a brain J Love Your Brain NL as we call it, and get them to sign up. So we're trying to encourage this type of mind body activity for everybody in general and for people with brain injury.
That's great.
Yeah.
Yeah.
So we're doing that now, and so that's a little plug for me for the Newfoundland Labrador Brain Injury Association. But this is a great talk, and thank you so much. I learned so much about how reading your research, but how yoga helps, and reading out the research about how yoga helps people with brain injury, and how mind-body awareness is very important for it. So thank you very much.
All right. Thank you very much. My pleasure talking with you. And good luck on the yoga awareness or yoga for brain injury awareness. I hope you get lots of people signed up.
Thanks. Thank you so much.
All right.
I would like to thank Kristine again for talking to me about her very interesting research. I would also like to apologize for the audio quality at the beginning of this interview. I accidentally left my microphone up, and you can hear when I put it down, so I apologize for that. And also, please visit nlba.ca, especially if you're in St. John's or in Newfoundland at all, www.nlba.ca, to find yoga classes and yoga studios who are participating in this Love Your Brain NL month, Brain Injury Awareness Month. Thank you, everyone, for listening. As always, the music at the beginning of this podcast is by Ben Sound, www.bensound.com.